The human body is a complex marvel, and the female reproductive system is no exception. Within this intricate system lies the hymen, a thin membrane often shrouded in mystery and misconception. Welcome to Skin Treat, you home of skincare and women health issue. Kindly subscribe and give this video a thumbs up so that others can see it and be helped too. Situated at the opening of the vagina, the hymen is a normal part of female anatomy, present from birth. Despite its commonplace existence, the hymen is often subject to myths and misinformation. Understanding the hymen's true nature, its variations, and its lack of correlation with virginity is crucial for promoting women's health. It's time to separate fact from fiction and empower individuals with the knowledge to make informed decisions about their bodies. By delving into the science and addressing the cultural baggage surrounding the hymen, we can foster a more open and understanding conversation about female sexuality and reproductive health.
One of the most damaging myths surrounding the hymen is its association with virginity. This misconception equates an intact hymen with virginity and a torn hymen with sexual experience. The hymen can be stretched or torn through various activities that have nothing to do with sexual intercourse. These include physical activities like gymnastics, horseback riding, or even cycling. Inserting a tampon, especially for the first time, can sometimes lead to hymenal stretching or tearing. Certain medical examinations or procedures involving the pelvic area can also affect the hymen. The presence or absence of a hymen cannot definitively determine a woman's sexual history. Equating an intact hymen with virginity is not only medically inaccurate but also culturally insensitive.
Just like every other part of the human body, hymens come in various shapes and sizes. Some women have hymens that are thin and stretchy, while others have hymens that are thicker and less flexible. These variations are entirely normal and do not affect a woman's health or sexual function. Some women may have hymens with larger openings, while others may have hymens that partially cover the vaginal opening. In some cases, women may even be born without a hymen. It's essential for women to understand that there is no right or wrong way for a hymen to look. The diversity of hymenal anatomy is a testament to the natural variations that exist within the human body. If you have any concerns about your hymen or any other aspect of your reproductive health, it's always best to consult with a healthcare professional.
While most hymenal variations are harmless, there is a rare condition called imperforate hymen that can cause health problems. An imperforate hymen occurs when the hymen completely covers the vaginal opening. This condition can block the flow of menstrual blood, leading to a buildup of blood in the vagina and uterus, known as hematokolpos. This can cause pain, discomfort, and potentially serious complications if left untreated. Imperforate hymen is present at birth and is usually diagnosed during puberty when menstruation begins. Symptoms may include absence of menstruation, painful menstrual cramps, lower abdominal pain, and difficulty urinating. Imperforate hymen can be easily corrected with a minor surgical procedure called a hymenectomy. Early diagnosis and treatment are crucial to prevent complications and ensure normal reproductive health.
The exact purpose of the hymen remains a topic of debate among scientists. Unlike some anatomical structures with clear functions, the hymen's role in the female body is not fully understood. Some theories suggest that the hymen might be a remnant of fetal development, serving no specific purpose in adulthood. Others speculate that it might have played a role in protecting the vagina from infection during infancy. However, there is no conclusive evidence to support any particular theory. The hymen's function, if any, remains largely a mystery. What we do know is that the hymen does not affect fertility, sexual pleasure, or overall health in adulthood. It's essential to dispel the notion that the hymen serves as a barrier separating the vagina from the outside world.
Despite its lack of a clear biological function, the hymen has significant cultural meaning in many societies. An intact hymen is seen as a symbol of purity and virginity. This belief can have harmful consequences for women. The flawed belief in the hymen as a virginity indicator has led to harmful practices. It's crucial to challenge and dismantle these harmful cultural beliefs.
The hymen is not a reliable indicator of virginity. It can stretch or tear due to a variety of factors, and sexual intercourse is just one of them. Hymenal tearing is often painless and may go unnoticed. Some women may experience mild discomfort or slight bleeding, while others may not feel anything at all. The hymen is a delicate membrane, and its integrity can be affected by various activities, including strenuous physical activities. Engaging in sports or activities that involve stretching, impact, or pressure on the pelvic area can cause hymenal tearing. Inserting a tampon, especially for the first time, or if not inserted correctly, can sometimes lead to hymenal stretching or tearing. Certain medical examinations or procedures involving the pelvic area can also affect the hymen. Injury or trauma to the pelvic region can potentially cause hymenal tearing. The presence or absence of a hymen or its state of intactness is not a reliable indicator of sexual activity.
Navigating the complexities of the human body can be daunting, especially when it comes to sensitive topics like reproductive health. If you have any questions or concerns about your hymen, your vagina, or any aspect of your reproductive system, it's essential to seek guidance from a qualified healthcare professional. Healthcare professionals such as gynecologists are trained to provide accurate information, address your concerns, and offer personalized advice based on your individual needs. They can conduct a physical examination to assess your reproductive health and address any specific concerns you may have. They can dispel myths, clarify misconceptions, and provide you with evidence-based information about the hymen, virginity, and other aspects of reproductive health. Your healthcare provider can address any anxieties or fears you may have about your body, sexuality, or reproductive health in a safe and non-judgmental environment. Based on your individual needs and circumstances, they can provide tailored advice and support to help you make informed decisions about your health and well-being. Remember, your healthcare provider is your partner in health. Don't hesitate to ask questions, seek clarification, and advocate for your needs.
The conversation surrounding the hymen is often laden with judgment, shame, and misinformation. It's time to shift the narrative and foster a more respectful and understanding approach to this aspect of female anatomy. Every woman's experience with her body is unique and personal. Whether or not a woman's hymen is intact, whether she has experienced sexual intercourse or not, is her own private matter. It's not something to be scrutinized, judged, or used to determine her worth. Instead of perpetuating harmful stereotypes and expectations, let's create a culture of respect, understanding, and acceptance. By shifting the focus from judgment to respect, we can create a more supportive and empowering environment for all women.
One of the most powerful tools we have in combating misinformation and promoting women's health is education. By equipping ourselves and others with accurate, evidence-based information, we can challenge harmful myths and empower individuals to make informed decisions about their bodies. Start conversations. Talk to your friends, family members, and communities about the hymen, virginity, and the importance of accurate information. Break down myths, challenge stereotypes, and encourage open and honest dialogue. Share reliable resources. Direct people to credible sources of information, such as healthcare professionals, reputable websites, and organizations dedicated to women's health. Support comprehensive sex education. Advocate for comprehensive and inclusive sex education that provides accurate information about anatomy, sexuality, consent, and healthy relationships. Challenge harmful media portrayals. Speak out against media representations that perpetuate myths about the hymen, virginity, and female sexuality. By working together to promote accurate information and challenge harmful beliefs, we can create a more informed and empowered generation. Education is key to breaking down myths and promoting women's health.
As we move forward, it's essential to embrace a holistic approach to feminine health that prioritizes body literacy, informed choices, and respect for individual experiences, empowering women with knowledge, providing women with access to accurate information about their bodies, their reproductive health, and their options is crucial. Promoting body positivity. Encouraging women to embrace their bodies, regardless of shape, size, or any perceived imperfections, is essential for fostering self-esteem and confidence. Advocating for comprehensive healthcare. Ensuring access to affordable, comprehensive, and non-judgmental healthcare is vital for all women. Challenging societal norms. Continuing to challenge and dismantle harmful societal norms and expectations surrounding female sexuality and bodily autonomy is crucial. By embracing these principles, we can create a future where women are empowered to make informed decisions about their bodies and their lives. Let's move forward with knowledge, respect, and empowerment.